This episode is made possible by our sponsor, Omega Bright Wellness. I've taken their omega-3 supplements for many years, and so has my wife, and that's why I invited them to sponsor my podcast. I'm proud to have them. You can find all of their products online at omegabrightwellness.com, and bright is intentionally misspelled B-R-I-T-E, omegabrightwellness.com. This episode is also sponsored by Landmark College, another institution that I have warm personal relationship with in Putney, Vermont. It's the college of choice for students who learn differently. Learn more at lcdistraction.org. Hello and welcome to Distraction. I'm your host, Dr. Ned Hallowell. We have a wonderful guest today, one of my oldest friends, oldest in the sense of we've known each other a long time, not that she is old, but we go back, we were just talking before we started, to 1993 at a little conference in Ann Arbor, Michigan, where she lives, about ADHD and opening it up to adults, because back then people still thought of it as just a condition that children have. And she is a true pioneer. Her name is Sari Solden, Sarisolden, and she's just this wonderful, brilliant, kind, loving, smart, experienced person. And she really helped bring the whole conversation about ADD, ADHD to a female audience. Because, as I said, at the beginning, it was pretty much consigned to little boys, hyperactive little boys, and it took a long time to expand it. Well, the expansion happened in large part because of Sari Solden. She's been a psychotherapist for over 30 years and is the best-selling author of 3 books. Women with Attention Deficit Disorder, that was the groundbreaking first one, and then Journeys Through ADD Adulthood, in other words, adulthood, and her most recent book, a wonderful book called A Radical Guide for Women with ADHD. Really, really good. So for anyone who wants to understand ADHD, and particularly for women, or the men who would like to understand them better, get one of Sari's books, or even better, get all 3 of them. She has a private practice in Ann Arbor, Michigan, where she and her team specialize in providing psychotherapy and consultation to women and men with ADHD. So, thank you so much, my wonderful friend Sari Solden, for being here with us on Distraction.
Oh, it's so exciting to talk to you again, Ned. It's been a long time. I love talking to you and your audience.
Yeah. Well, just give us the headlines. What's special about women and their lives with ADHD?
Well, there's lots of things special about women and women with ADHD. It's difficult to get diagnosed, first of all, even now as a woman with ADHD, because often, like you said, we don't meet that stereotype of a hyperactive, troublemaking little boy. And so that causes a lot of difficulty, not just with the diagnosis, but throughout life, because your self-image, because you didn't know, is sort of conflated with your unique brain wiring. So early on, often little girls are the opposite of what you would think. They're people-pleasing. They're internalizing their difficulties. They're often doing well in school, but they're masked by support they're often getting at home, or structure, or being smart, and often their diagnosis is delayed until they hit a wall, either when they go to college, or when they get married, or when they try to do other things that other people at their own ability level can do. And then they're often diagnosed as depressed or anxious. So it takes many years often to untangle these things. And in the meantime, women are left feeling so confused and with a distorted kind of sense of self about themselves.
Mm-hmm. What age do you see people getting diagnosed, women or girls?
Well, if you're lucky, you're a girl and you're acting out, you come to someone's attention, you can get diagnosed. But often I have people from their early 20s all the way through. My oldest client, I think, got diagnosed after she heard me at 80, and she died in peace at 85 after knowing what she had struggled with her whole life. So it really runs the whole gamut. It just depends often if they have kids who are getting diagnosed, they find that out, or there's so much more resources now. But really, it runs a gamut. I would say middle, perimenopause, or right around there, a lot of women start to lose any kind of compensations they might have developed because of these extra difficulties, and they start to seek some help.
Yeah, my daughter was one of the lucky ones. She got diagnosed in the 3rd grade, and she's now 31 and is a marketing executive for the National Football League.
I heard you say that. And it's funny to say lucky, but it is lucky because you can identify it, you get support, you know what's going on in your own brain, even though you might be having difficulties. But you can imagine being smart and having all these amazing ideas and all these amazing characteristics, and you can't figure out why you can't manifest it, why you're so disorganized, overwhelmed, even though, maybe you're successful in other areas. So nobody can understand you or believe you.
Mm-hmm. I've recently voyaged into the world of TikTok. It's amazing. Someone told me I should do it a month ago. And so I've posted, I think I've got about 15 or 16 60-second posts on ADHD and TikTok, and much to my amazement, they've so far received about 4 million views. There's a tremendous appetite for, I think, that format, the 60-second soundbite. Where you can say a lot in 60 seconds. But one of the questions that keeps coming up on TikTok is there a link between estrogen hormones and ADHD? And you're the one to ask. So what about that?
I mean, I'm not the one to ask, but I do know enough about it to know that whenever you're hitting a particular hormonal challenge in your life, it's going to affect your estrogen and your ADHD. So particularly around perimenopause, when you start to sort of withdraw from your estrogen, it's going to also affect the dopamine. And so that's why people start to have more difficulties premenstrually, at puberty. Anytime you're starting to, lower the estrogen, you're also affecting the dopamine, which is involved with these executive functions and the ADHD.
So would it make sense for a woman who's perimenopausal to combine estrogen supplementation with stimulant medication?
Well, I would definitely say to try to involve both doctors, your psychopharmacologist and your gynecologist. Good luck, but hopefully they could talk. There's more, controversy about hormone replacement therapy these days, so not always a good idea for everybody. But often to increase or change your medication, you'd be the expert on that. But to up your dose even before periods, people start, maybe needing to increase, at least if the main thing, Ned, I think, is besides fooling around with the medication, which you definitely need to probably tweak around those times, is to know what's going on, to know that this is happening, to know that you're not going crazy, you're not necessarily developing Alzheimer's, which is what most women with previously undiagnosed with ADHD or even with ADHD start to fear, because their memories get, so much even more impacted around this time. So, the fear takes over, and so you can adjust your life in many ways to make it work better for you if you're going into a period like this and you know what's happening.
Mm-hmm, mm-hmm. So talk it over with your gynecologist or someone who understands hormones, and with your ADD doctor. It
would be nice if everybody understood it and talked to each other, but sometimes you have to push a little bit and try to advocate for yourself, which is always hard for women. And, that's really what I'm about now with women. It's not just about their ADHD now. I think what's different in my new book is we're just talking about a woman now who has brain wiring differences and difficulties, but certainly that's not the only thing that's defining her or by which she needs to measure her own worth. And so, learning to speak, learning to move a little bit more into the center of your own life, learning to use your voice, learning to have power in the world and in the relationships. So I guess our emphasis more now is for women, not just to see themselves only through this lens, but to see themselves as all women need to, as powerful people in the world, learning to live a fulfilling life. And, the ADHD is one track. It's chronic. It's your brain. It needs support and medication, strategies, all that. And that's chronic, but that has to be untangled from you as a woman, as a whole human being who has strengths and gifts and needs to move into a life. And the problem with women is that they don't do that. They come in all wanting to be fixed, all wanting to wait until their ADHD is gone or until they're perfectly organized. So I guess what I've been identified with, most of my writing, has been these gender role expectations that all women are subject to, but women with ADHD have internalized these expectations and idealize them. And so this idea that they carry inside of them about what a woman should be able to do, or why can't they be like other women, these messages from the media, from growing up, from everything around them that they can't do well, that stays with them and really wounds them and haunts them. And that's a big part of the work, is not just managing, their brain, but really digging in much deeper. I guess I think of it as healing more than curing. I think that's a better way of thinking about ADHD, because, restoring a person to this feeling of wholeness about themselves and viewing themselves much more accurately, not just viewing the difficulties or just the strengths, just as a whole person with who are you, your enduring traits, your resilience, your humor, creativity. I know you believe all this too, Ned, but just moving forward in your life and not waiting to get over, you have to, like you say, you just have to be as organized as you need to be to move, but for a purpose, to move towards something compelling, not just to get over, not to be perfectly organized.
Right, exactly. Over the past few months, I've spoken to my friend, the founder and creator of Omega Bright Wellness, Dr. Carol Locke, about the benefits of taking Omega Bright's omega-3s, CBD, and other supplements. Here's a clip from one of those conversations. Could you tell us a little bit about the recent study that showed Omega Bright reduced inflammation and anxiety in medical students?
This is a great study. It was done at Ohio State, and it was done on medical students, 68 medical students without any medical problems, done over 12 weeks. And it was a blinded study, meaning the researchers and the students did not know if they were taking the Omega Bright or the dummy capsules. And what it found was a 20% reduction in anxiety and a 14% reduction in the inflammatory cytokine IL-6. Wow. So that you had a very powerful benefit from the Omega Bright shown in this study. And that's something that people could use right now in their life, reducing their anxiety and stress and inflammation.
Distraction listeners, you can save 20% on your first order at omegabrightwellness.com by using the promo code PODCAST2020. All right, let's get back to today's topic. Can you talk a little bit about brain shame and the patterns you've identified in the neurodiverse women you work with?
Oh, you must have read my essay. I wrote an essay called Brain Shame.
Yeah, exactly.
Should have reviewed
Imagine that. I would actually read something you wrote, Sarah.
Oh, my God. I would have reviewed it had I known. Well, I talk about it as similar to body shame. And it's important now, even as we all get older. Even my mother, when she was 85, said, I feel so ashamed. I can't remember something. So we feel so ashamed about our brains, no matter what age we are. And especially women with ADHD, they compare themselves. So it's like that, as if you went to a doctor and they said, okay, well, this week, we're going to measure success on how much weight you lose this week versus, okay, how can you feel well and have wellness and feel good about yourself. And, instead of measuring your worth by, becoming a size 3, it's the same thing with brain shame. Women, compare themselves in very toxic ways to other women who can multitask and go to the gym and take care of the kids and work and take care of the house. And, so executive function for women is so central to their functioning. they believe still. And it's amazing. The women I work with in their 20s, you would think would feel differently. But in therapy, when push comes to shove, there's still this idea that they wouldn't be able to cook or clean or do all these things well enough to, or entertain or do all the birthday cards and all the cards and niceties of life, all the stuff women still feel is their job even now, and still have no way of communicating and measuring their worth, and letting themselves be in one-down positions in relationships because of this. Even if their spouses don't blame them so much, they carry this with them and feel like they're not equally valuable in a relationship. And that's part of the big work in therapy.
And how do you help them with that, Sari?
I think there's no substitute, first of all, as a therapist for really seeing your clients, seeing them, knowing them, listening to them. And it takes a long time, sometimes depending on how much they devalue themselves. But when you're working with a counselor or a coach or anybody who can really see you, or other group members who have some of the same issues as you do, eventually those women start to internalize themselves or trust you enough to start taking small risks, moving slowly toward the edge of their comfort zone, to start having new positive experiences of themselves, starting to do something new, read at a poetry reading. I had one client, she joined the talent show at the latest conference after I encouraged her, doing something new and getting other people to see you and value you for a larger picture than your ADD difficulty. So it's that's the hard part, getting to a place where somebody, through your view of them, can start to see themselves in a new way. And once that happens, instead of just starting out changing, berating yourself, instead of just accepting yourself, we always say in our book, only dogs and furniture need fixing. So getting people over that idea that they have to be fixed. You have to support your brain and get help for it, but for the purpose of you moving into new areas of success, and where you have to find people who can value you and see you. And sometimes you have to start out in ADD support groups with that, and then move into other people who do other things that you do, creative people, adventurous people, other people who are like you, and instead of always feeling like you're different. Women with ADHD, the biggest problem they have is not their ADHD, it's their hiding and pretending and moving away from people and avoiding things and being inauthentic. And so through the book, especially our workbook, we try to help people develop a healthier relationship to their brain and to themselves, and to understand what they learned about being different, how difficult, the messages they got about that. And, these days, to learn to be different, what else do we need in this world except to accept our differences, to celebrate differences, to unite with people who have other differences, and to embrace all that. And this is a perfect time in the world for that message.
Yeah, really. And when you say a perfect time, because why?
Because of the world where everybody's moving away from each other, and there's so much, anger and hostility and differences. And, we have to start to work toward accepting ourselves, being role models, for sometimes people say, well, how can I be a good parent, a good mother to my children when I have these problems? And I always say, well, you can be a role model to your children by teaching that we all can accept ourselves with differences, and that we accept other people who are different from us. So whether it's the racial differences in the world or the political differences, we're not going to get anywhere until we all start to model that we can embrace our own differences and welcome other people with differences and respect each other's differences.
Yeah, no, so true. And where you and I work is in the realm of mental differences and brain differences, the sort of invisible differences, but they're very real.
They're very real. And, and neurodiversity is just part of diversity in general. And, that's why I like to call it neurodiverse now instead of ADHD, which is such a stereotype now and nobody understands it. But when you just say we're all different, we're all similar in a lot of ways, and we're all different. Everybody has differences, ADHD or other stuff, and you have to know your particular difference and work on it. But, that's not all of who you are.
I want to tell you about Landmark College in beautiful Putney, Vermont. It is the best college in the world for students who learn differently. with ADHD, for other learning differences, or autism spectrum disorder. It's fully accredited, not-for-profit, offering bachelor's and associate degrees, bridge programs, online dual enrollment courses for high school students, and summer programs. They use a strength-based model at Landmark, which, as you know, is the model that I certainly have developed and subscribed to give students the skills and strategies they need to achieve their goals in life and really expand upon what they believe they're capable of doing. It is just a wonderful, wonderful place, and I can't say enough good about it. I myself have an honorary degree from Landmark College, of which I am very proud. Landmark College in Putney, Vermont is the college of choice for students who learn differently. To learn more, go to lcdistraction.org. That's lcdistraction.org. Okay, let's get back to today's topic. Looking forward, what do you see coming down the road in the world of ADHD?
Well, I think this broadening out to neurodiversity is important also, instead of just, I think it just become meaningless. It's become stereotype. It's become people don't take it seriously. And so really, advocating for a broadening out of that. But I'm working now with a lot of professional women, neurodiverse professionals. Actually, I'm getting a lot of satisfaction out of. I did a long course on changing the conversation so that from pathology to humanism, so that I'm trying to teach people across domains, whether they're therapists or doctors or organizers or coaches, podcasters, support group leaders, like to look at people over pathology or viewing someone as who they are, self over symptoms, because we had to move from character to the medicalization for a while, but now we have to go back to humanism. And I think, if we understand that you don't treat people with ADHD as just like a person, a different breed of person. A lot of people just see ADHD people in therapy as, okay, that's an academic problem, or, get them accountable, whatever they want to say. And versus saying, okay, here's a human being, and they have these particular difficulties, and this is who they are as a person, and, this is their whole life. And so that's part of what I'm trying to do, is change the conversation around people who have neurodiverse brains from something they just have to get over or work on, tips, tools, strategies, versus, hey, this is who you are as a human being. We'll work on this, but you need to, figure out who you have a right and feel entitled, for women to feel entitled to move to a more fulfilling life and fulfilling relationships, because a lot of times women don't feel like they're entitled to that if they still have, clutter. I tell people, I don't treat disabilities. I help people unwrap their gifts. Exactly.
And often it begins by convincing them that they have gifts to unwrap. The shame is so great, the shame is so great.
Yeah. And and so the shame becomes like, my desk is messy, to I'm a mess, to I'm bad. I mean, the shame is very deeply in there. And so if you see their gifts, then they're able to believe that eventually. But no one is usually seeing their gifts. So sometimes what we do as clinicians with people like that is just see them. I mean, that's a big gift in itself to them.
Yeah. Absolutely, it is. Absolutely, it is.
Yeah.
Well, I could talk to you for a long time, but our podcasts are, have an audience that can't pay attention all that long, so we should wrap up.
Exactly.
To learn more about Sari, or to purchase one of her books, go to Sari, Sari, Solden, Solden, SariSolden.com. And you can find her blog at ADHDRadicalGuide.com. It's so nice to have you, and go out and buy her books. The most recent one is The Radical Guide, and then the first one was Women with Attention Deficit Disorder. That was really such a groundbreaker.
Yeah,
you can find Distraction.
I just want to say that these groups I'm talking about, these mentoring professional groups for professionals who have ADHD, that's on my website too, that I'm really excited about.
Oh, good. So they can find groups... mentoring professionals. Wonderful. Oh, that's wonderful. Yep. And that's at SariSolden.com?
Yeah.
Oh, that's a great thing for
Yeah,
for
it's
anybody
exciting.
professional who wants to,
Who are neurodiverse professionals who work in the
Yeah.
field. I'm really excited about that.
yeah. See, I think we're all neurodiverse, so you could invite everybody. But
You're all welcome. Come along, Ned.
I'd love to join.
All right, go ahead now. I'll be quiet.
No, you can interrupt it. This is the boring part. I read the close to the show.
Okay, go ahead. Thank you for inviting me. Okay.
Well, no. I'll stay on and I'll say goodbye. You can find Distraction on all the social channels, and you can now find me on TikTok. My username is @DrHallowell. I've uploaded a bunch of ADHD-related videos, 60 minutes, 60 seconds apiece, and I'd really love to hear what you think. Send me a DM or email, connect@distractionpodcast.com. That's connect@distractionpodcast.com. Distraction is created by Sounds Great Media. Our producer is the extraordinarily talented Sarah Guertin, and our audio engineer and editor is the equally extraordinarily talented Scott Persson. I'm Dr. Ned Hallowell, and thank you so much for joining me and my wonderful special guest, Sari Solden. The episode you just heard was made possible by my good friends at Omega Bright Wellness. I take their supplements every day, and that's why I invited them to sponsor my podcast. Shop online at Omega Bright, and that's BRITE wellness.com.